bright and early. Good morning, Congresswoman.
Good morning, Bill. How's everyone over there?
We're
Over at my home. Missing all of you.
Oh, well, we appreciate you joining us this morning. Of course, want to talk about a few things. Of course, health care has been a major issue. We've seen, the president promising all sorts of things, a phenomenal health care plan, but the House is actually doing something on this. Tell us more.
Yeah, thanks, Bill. So, as many of you may remember, for me, healthcare was one of the top priorities during the campaign, and the reason why I decided to run, because what we've seen is that the Republicans here in the House and also in the Senate and the president continue to try to repeal the Affordable Care Act. So they've taken it to the courts, and they're trying to just repeal it. And we have in our community, most of the people living in our community depend on the ACA to get their health care. So what we've been doing since January, I have worked with several of my colleagues on a bipartisan manner with some of my colleagues who believe that we need to do something here. We've passed 10 major healthcare bills. The most significant ones are the one that will protect people with pre-existing conditions. That includes if your child has asthma, if you have diabetes, insurance companies should not discriminate on that condition to charge you higher premiums. So we are protecting people with pre-existing conditions. We're also, that bill would lower the premiums that you pay on a monthly basis. I'm very proud to say that I introduced just last week a bill in a bipartisan fashion that would hold pharmaceutical companies accountable so that they don't continue to control the patent laws that they right now are monopolizing it. So it makes it very difficult for generic drugs to enter the marketplace. That would reduce prescription drug prices. The problem is that Senate Majority Leader Mitch McConnell continues to refuse to take these critical bills up in the Senate. We are putting the health of Floridians and people all over the country at risk, and we just should not allow that to happen. So I'm putting pressure. We need to all put pressure on our senators so that they can ask the Majority Leader McConnell to bring these bills up for a vote.
Mm-hmm. Okay. You're also supporting a new AIDS initiative. Tell us more about this.
Yes. Last week I was able to introduce an amendment that would bring an additional $5 million for HIV/AIDS prevention and treatment. Unfortunately, even though that throughout the country the rate of infection has decreased, in Miami and in South Florida, the rate of infection now is 3 times higher than the national average. And part of what this would do is provide funding for preventive medicine, like PrEP 305 is what they call it. There's a program in South Florida that's working with the University of Miami to provide preventive medicine. There's a lot of stigma associated with specifically minority groups like Hispanic groups, African American groups, that the rate of infection is higher because there's a lot of stigma in the culture of really being outspoken on needing this preventive medicine. So this will help support that program in South Florida, and it was passed with bipartisan support, with significant bipartisan support. So I was very excited to see that.
Mm-hmm. Now, recently, HUD has come out with a rule targeting households of mixed immigration status. There might be, some of them might be legal, some might not be legal. They're talking about separating these families.
Yes, Bill. This is just heartbreaking to me. I visited the Homestead facility once again on Monday, and I'm seeing children that are younger. And I spoke with this one 13-year-old boy who had come to the country with his sister. His mother lives in California, and they separated him from his sister. The sister and the mother in California. He's been in the shelter for now 44 days. And the only reason why they're keeping kids like that in the shelter is because they're profiting. It's a for-profit company managing it. So I suspect that this new policy of deporting immigrants who don't have papers here in this country and then separating them from their kids falls along the lines of profiting from these children. This president is right now in Florida. He will be in Doral this morning, I guess. And what I've heard from him yesterday is just words that divide. We need someone that can lead this country and unite all of us. We're all different. But I know that in our community, Bill, in Florida 26, I know that we respect the contributions that so many immigrants make. And I've talked to so many business owners that tell me that what we need to do is find a fix for our immigration system, provide a path so that they can become legal. Many of them have been here for 10, 20 years, but the problem is that there is no path for them to become legal residents or legal citizens. They're here to work. They're here to contribute. We should not instill fear. I know that in South Florida, we're better than that. And so I hope that our community sticks together on this one.
Congresswoman Debbie Mucarsel-Powell joining us live here on Morning Magazine. Congresswoman, thank you for joining us. Appreciate it. We will talk more next week.
Thank you so much, Bill.
Take care. Bye.